Well, the beginning of the year is the perfect time to start fresh and feel like you again by getting rid of that back and neck pain you've always been living with. Take a look. How many times a day do you say or think this? My back hurts. Well, Dr. Gil can help take that phrase out of your vocabulary.
Spinal decompression is an advanced technology that's used to treat degenerative, bulging, and herniated discs, sciatica, chronic back pain, and a number of other conditions that can ordinarily only be treated with epidural injections and back surgery.
So how exactly does spinal decompression work?
Well, the treatment gently separates the vertebrae in the spine. If this is a bulging disc, a herniated disc, for example, the machine begins to gently separate the vertebrae, creating a negative pressure, a vacuum, to draw this material back in position to get pressure off these spinal nerves. When these nerves are free of pressure, it relieves the sciatic pain, the terrible hip and leg pain that many people experience.
Dr. Gil also has technology that treats the neck and gives patients a lot of benefits with cervical decompression.
Well, the technology is very gentle and comfortable and safe. A person would lie comfortably on their back. The device attaches to the neck. It begins to gently separate the vertebrae in the neck, creating this vacuum effect, allowing fluids and nutrients back to the disc to help heal that damaged or injured or inflamed disc.
So what causes the pain in the first place? Dr. Gil says usually it's caused by previous traumas like a car wreck, injury, fall, or maybe they even work in a position that puts stress on the back and neck. Of course, the earlier you treat the problem, the better. Here's why.
Here we see a normal disc and a normal joint. This joint has normal range of motion and flexibility. This person would have no pain. Here we start seeing degeneration and thinning of the disc material. And finally, the degeneration becomes worse with spurs, loss of movement. The nerve becomes pinched as it exits the spine. These are the conditions that we treat with spinal decompression and many of the other technologies that we use. If it's left untreated, it can even begin fusing together, where now the joint has lost all of its movement and the nerve is severely pinched as it tries to exit the spine. So we don't want to wait and leave this thing untreated until the person is in severe distress with their problem.
That's why it's important to treat it early on. Dr. Gil will also provide an exercise rehabilitation program during your treatment program.
We do many of the exercises here in the office with machines called MedX machines. We also give the patient specific home exercises to do and instructions so that we can keep this problem under control and it won't keep coming back.
So you can say bye to back and neck pain forever. And if that's what you want to do, Dr. Gil has a special offer for you today.
The first 25 callers will receive an examination, 2 x-rays, report of findings, and their first treatment, all for $39. Now, we've offered this in the past for $79, but now for the first 25 callers from Channel 4, we're doing a special opportunity for $39. The number to call is 794-0800, 794-0800.
Again, the first 25 callers to say they watch News and More at midday will receive an exam, 2 x-rays, their report of findings, and their first treatment, all for only $39. The number to call is 615-794-0800.